Clinical rotation in Obstetrics and Gynecology for 9th semester students of the Faculty of Medicine. The Obstetrics and Gynecology, Obgyn, clinical rotation in the 9th semester aims to provide medical students with a comprehensive understanding of women's reproductive health, management of normal and high-risk pregnancies, the childbirth process, and gynecological diseases. This rotation integrates theoretical knowledge with clinical practice in various healthcare facilities, such as outpatient clinics, delivery rooms, maternity wards, and operating rooms. 1. Objectives of the Obstetrics and Gynecology rotation. Clinical competencies: understand the female reproductive cycle, pregnancy process, childbirth, and postpartum period. Manage women's reproductive health issues, both acute and chronic. Develop antenatal, labor, and postnatal management plans. Procedural competencies: perform basic obstetric procedures, such as pregnancy examinations, contraceptive device placement, and perineal suturing. Assist in gynecological surgeries, including curettage and cesarean sections. Communication and collaboration: communicate with patients and families about delivery plans, pregnancy risks, and gynecological issues. Collaborate with multidisciplinary teams, including midwives, nurses, and specialists. 2. Learning structure and daily activities. This rotation includes training in various clinical units. A. Obstetrics and Gynecology outpatient clinics activities. Antenatal care to monitor maternal and fetal health. Counseling on contraception and reproductive health. Managing gynecological cases, such as reproductive tract infections or uterine fibroids. Objective: understand outpatient management of pregnancy and gynecological disorders. B. Delivery room activities: monitor labor progress using a partograph. Assist normal deliveries under supervision. Manage obstetric complications, such as postpartum hemorrhage. Objective: train students in delivery techniques and emergency obstetric management. C. Inpatient ward activities: manage patients with pregnancy complications, such as preeclampsia or gestational diabetes. Monitor postpartum mothers and newborns during the puerperium. Objective: provide holistic care for mothers and newborns. D. Operating room activities: observe and assist in obstetric surgeries, such as cesarean sections. Observe gynecological surgeries, such as hysterectomy or laparotomy. Objective: understand surgical techniques and aseptic principles in obstetrics and gynecology. E. Emergency unit, Obgyn emergency unit, activities. Handle obstetric emergencies, such as eclampsia, uterine rupture, or septic abortion. Stabilize patients before definitive treatment. Objective: train in triage skills and rapid response to emergencies. 3. Diseases and conditions covered. This rotation covers a variety of conditions related to reproductive health, pregnancy, childbirth, and gynecological diseases. A. Normal and high-risk pregnancy. Normal pregnancy. Antenatal monitoring, measuring fundal height, detecting fetal heartbeats, and performing ultrasound examinations. High-risk pregnancy, preeclampsia and eclampsia, diagnosis, magnesium sulfate management, and delivery preparation. Gestational diabetes, dietary management, insulin therapy, and fetal monitoring. Skills: use of partographs, obstetric physical examination, and pregnancy ultrasound interpretation. B. Labor process. Normal labor, labor stages, normal delivery techniques, and placental management. Intervention labor, labor induction with oxytocin or prostaglandins. Cesarean delivery for indications, such as placenta previa or failure to progress. Labor complications, postpartum hemorrhage and perineal tears. Skills: episiotomy techniques, perineal suturing, and postpartum hemorrhage management. C. Women's reproductive health. Menstrual disorders, diagnosis and management of menorrhagia, dysmenorrhea, and amenorrhea. Reproductive tract infections, management of cervicitis, bacterial vaginosis, or pelvic inflammatory disease, PID. Contraception, counseling on contraceptive methods, IUD insertion, and implant placement. Skills: speculum examination, contraceptive device insertion, and endometrial biopsy. D. Gynecological diseases. Common conditions, uterine fibroids, clinical evaluation and surgical therapy. Ovarian cysts, diagnosis with ultrasonography and further management. Oncological diseases, cervical cancer, early detection through pap smear and colposcopy. Ovarian cancer, understanding indications for surgery and chemotherapy. Skills: pelvic examinations and sampling for histopathological diagnosis. 4. Mastery of clinical procedures. Students are trained in various procedures relevant to obstetrics and gynecology. Basic procedures. Obstetric physical examination, fundal height, Leopold's maneuver. Vaginal examination to assess cervical dilation. Normal delivery assistance and perineal suturing. Advanced procedures under supervision, insertion and removal of intrauterine contraceptive devices. Curettage for incomplete abortion, assisting in cesarean sections. 5. Learning methods. A. Bedside teaching. Direct learning in wards, outpatient clinics, and delivery rooms under specialist supervision. B. Case discussions presenting clinical cases, including history taking, diagnosis, management, and follow-up plans. C. Clinical simulations training in procedures, such as neonatal resuscitation and episiotomy techniques, using simulators. D. Observation and participation, observing and participating in obstetric and gynecological surgeries. 6. Assessment. Comprehensive assessments ensure students' competencies. A. Daily evaluations assessing history taking, physical examination, and clinical skills. B. Mini-CEX direct assessment of practical skills, such as pregnancy examinations or IUD insertion. C. OSCE simulation-based examinations for obstetric and gynecological procedures. D. Logbook documentation of clinical experiences, including the number of deliveries and procedures performed. 7. Challenges and opportunities. Challenges. Students may feel uncomfortable discussing reproductive health issues with patients. Assisting in the first delivery can be a nerve-wracking experience. Opportunities. Direct experience in managing childbirth and women's reproductive health. Learning the importance of effective communication with patients and families. Conclusion. The Obstetrics and Gynecology clinical rotation prepares students to address various aspects of women's reproductive health, pregnancy, and childbirth. Through structured learning and close supervision, students are trained to become competent doctors capable of providing quality health care to female patients in the future.